Back at you with another video. I know it's been a little bit of a long time since I've posted. I've been super busy with residency, as you would know. I can definitely explain about my life about that later on. But gotten questions on how I matched my specialty of choice, which is what I've been going into, and it's radiology. How to match it to this rather getting more competitive of a field, has board scores that are on average a little bit higher than anesthesia, internal medicine, and some surgical fields, but still definitely able to be matched, has a very high match rate, but again getting more competitive given that it's a little bit more of a relaxed lifestyle. It definitely fits one of the road specialties, meaning radiology, optho, anesthesia, dermatology, a little bit more of those programs that are a little bit more cush, I should say, but a little more laid back. But again, you're learning a lot of medicine. It's definitely still a very hard field, because you have to learn a wide variety of fields. I have to know pathologies from every single subspecialty, every single pathological organ that could be wrong with it. I have to know what the imaging findings are going to be and what the implications are. So first and foremost is getting more exposure to radiology during medical school. I feel like you guys just don't get enough exposure to some of the medical fields that you could go into, especially the specialty ones other than internal medicine and surgery, because there isn't necessarily a radiologist that's teaching you any lectures during the first or second year. So I would urge you to try to either ask your friends who are radiologists or who are some of those other specialties that you may be sort of interested in but haven't gotten enough exposure to prior to medical school or during it. You can even try to shadow them, try to get some exposure onto what radiology is and what they do on a daily basis, being in the reading room on what they do. So let me explain about it a little bit. What they do is basically they're going to be in a dark room reading imaging findings on a screen, on a rather expensive screen. Some of the screens can be run up to over $20,000 just to really get the quality imaging findings and the pixels that they would otherwise feel comfortable with you reading as a physician in order to create an impression and sort of see what's going on in the picture, what's going on in that image of that patient. The radiologists are the ones putting in their impression and reading the imagings and their findings onto the electronic medical record system in order for the ordering physicians or whoever it was who ordered the imagings, etc., to look at those findings and say, hey, this is what they saw. They can look at the imaging themselves, but you're the ones who has the proper training and the pretty long course of residency in order to be able to do that. So they're not the ones who are ordering the images. That's usually going to be the internal medicine, family practice, surgery, whatever it is, the main sort of front line, I should say, healthcare physician that's sort of evaluating the patient clinically and deciding on what imaging that they would want, and then it's up to the radiologist to sort of see what they're seeing on the image, what pathological findings there are that could otherwise explain the clinical correlation or the clinical picture that the patient is being presented with. Now, as I had alluded to earlier, radiology is becoming a little bit of a competitive field in that the board scores tend to be a little bit higher than a lot of the other specialties on average. Try to do really well in your step 1 USMLE score. And if not, try to do well in your step 2. I will say that step 1 is rather heavy in radiology because it's definitely a lot of diagnostic pathologic findings that's really heavy on step 1, and it may even have some sort of an effect on how you match during fellowship. So let me just explain that radiology is a year of a preliminary year, whether it's surgery, medicine, or transitional, then 4 years of diagnostic radiology where you're learning every single imaging modality and how to read main pathological findings, and then you do 1 to 2 years of a fellowship, and there are multiple different fellowships, and that's becoming more and more common to do a fellowship after diagnostic radiology in order to become a little bit more competitive down the line when you're looking for jobs and when you're applying for businesses, or if you're trying to become an attending in the hospital, trying to become an academic radiologist who's teaching other residents below them. Fellowships are becoming a lot more important. So therefore, board scores still matter even down the line after you match your main residency match. Now you're probably wondering, well, I don't really get to do much patient contact if I go into diagnostic radiology because you're pretty much just in a room, in a dark room and doing imaging findings. And are radiologists even social people? I mean, they aren't talking to anybody in the hospital, and I will argue that yes, radiologists can be very social. I think that's a terrible connotation because I'm super social outside the hospital, like, let's be honest, and I don't necessarily need to socialize in the hospital, but I still think it's very important to be able to do that in the hospital setting and still be nice and talk to your colleagues, because part of the interview is knowing your hobbies and knowing how you are and how you are as a person, because you're going to be spending 4 years in a room with other people, other residents, your attendings. You kind of don't want to be that annoying guy. You don't want to be super uptight and just be weird, I guess. I mean, so that was definitely a really heavy part of my interview trails. What were my hobbies? How was I as a person? What were my interests outside of the hospital, essentially? The other thing is that you actually can get a lot of patient contact in radiology if you do a fellowship that involves procedures. For example, some of the fellowships are mammography and breast imaging that would involve using an ultrasound guided imaging of breasts in order to gain tissue biopsies and that sort of thing, and FNAs. Another field is MSK, which involves contrast injection into joints to really image the joint better. Other fellowships that may not have as much patient-centered contact but still are important fellowships for you to look into when you're trying to look for a job down the line would be abdominal imaging, which involves CT and MRI of the abdomen, becoming a professional at that. Another fellowship is neuroradiology, where you're doing CT and MRI findings of the brain and the head. Now, you're probably also wondering about interventional radiology, which in some hospitals is still a fellowship, a 1-year fellowship after diagnostic radiology. Some hospitals are changing it to ESIR, meaning you get into it faster after I think the second or third year. Then you really start doing a lot of interventional radiology after those certain number of years. Or some hospitals have it that it's just a completely owned separate match, and that's really starting to become the main thing now. It's kind of becoming like radiation oncology, where it's just its own residency match. So if you're interested in interventional radiology, I would definitely try to figure that out early on, because you're definitely going to have to do a lot more research, be a lot more headstrong, because that's a very competitive field that people try to get into. But for diagnostic radiology itself, I wouldn't necessarily say that research was a very heavy part of my application process. I wouldn't necessarily say that would make or break your application. I definitely had some research, but I definitely wasn't doing research constantly. I had abstracts and some publications on my resume, but I definitely think what helped me was just being able to socialize well, having good board scores, doing well on my clinical rotations, and then doing well in medical school. And I think all those things are going to be important, essentially, for any specialty that you do. I wouldn't say that there's one necessarily big overriding thing that made me match radiology. I would just say try to do all those things and be able to really know yourself and know if this is the field that you want to go into. If you guys have any other specific questions about my match or really anything else in medicine, please let me know. Please like and subscribe, comment, and give me any questions below. And as always, good luck.